With the kickoff of another sports season, sports-related pediatric concussion injuries can sometimes be part of the game.
Typically, patients have their symptoms resolve within the first 2 weeks after a concussion, but some patients continue to have headache, dizziness, irritability, balance problems beyond that initial period.
For kids whose concussion symptoms lasted more than 2 weeks, a team of UW-Medicine researchers studied patient treatment records for kids with sports-related concussions between 2010 and 2016 to see if an MRI scan was an effective way to diagnose brain abnormalities.
During that 6-year period, we had over 3,000 patients who had a diagnosis of concussion. 427 of those patients had an MRI, and then we looked for structural abnormalities on those MRIs and really found only 2.
That low number is what researchers call rare. The 2 patients whose MRIs showed brain injury each had a history of concussions. Both were advised not to play sports.
For the typical patient, based on this study, which is the largest study of its kind, we would say that the typical patient with concussion does not need an MRI to evaluate persistent concussion symptoms.
If you think your child has a concussion, experts say stop playing sports, consult with a doctor who treats concussion, and keep your young athlete at rest until cleared by a physician to return to play. From the UW-Medicine newsroom in Seattle, this is Megan Clark.